the first kind of big topic we're going to talk about, and I think the reason I wanted to have this call is how to protect your family. And I think we've learned a lot, and I want to kind of share all the stuff that I've learned so far with you guys. So I think the first thing is, how do you get COVID? And I think that this is really important, and we've really learned a lot over the last couple of weeks to months about how you get this disease. And so the overarching theme is sustained contact with someone who has this disease, which the vast majority is people with fever and aches, or someone who is about to get the disease. So someone in the next 1 to 2 days who is going to develop symptoms of this disease. And so the way that you get this is the transmission of the virus almost exclusively from your hands to your face. From your hands to your face. And so it's either into your eyes, into your nose, or into your mouth. So there's a lot of talk about contact or getting it through contact, hands to face. There's also a small thought that it can be aerosolized, that it can kind of exist a little bit in the air. The thought at this point is that you actually have to have very long, sustained contact with someone. And I'm talking about over 15 to 30 minutes in an unprotected environment, meaning you're in a very closed room without any type of mask, for you to get it that way. But to very simply state, the overwhelming majority of people are getting this by physically touching someone who has this disease or will develop it in the next 1 to 2 days, and then touching their face. And so that actually, I think, is incredibly empowering. And that's, as I've been in the hospital the last 2 days, the thing that makes me smile a little bit is that I actually know now that I won't get this disease because I know how to protect myself. And so I just want to give you guys a few very, very practical tips to how to protect yourself. COVID is in your community. I'm going to say that again. Whether you live in Texas, whether you live in Tennessee, whether you live in Florida, it is in your community right now. That is not to scare you. That is to just tell you so that you can then take the steps that I'm talking about and not be scared. So the first step, which I think is incredibly clear, is to become a hand Nazi. Know where your hands are and know that they're clean at all times. So very simply, for what this means for me in the city is that I walk around with Purell. And so when I leave my apartment, everything that I see that I'm going to touch, I make sure that I Purell first. So when I leave my apartment door and I go to the elevator, it's okay that if I touch it with my hand, but then I Purell it. When I go downstairs and I open the door, it's okay to touch the door. You can open it with your elbow, but if you touch the door, then I make sure to Purell it. So we know that if you keep your hands clean, that you're not going to get this. The second point is that this is not a disease that we're getting because someone is sick and touched something and then an entire community of 10 people get it because they touched that. It's mostly from sustained contact with people who have COVID-19. Out of abundance of caution, we also make sure that everything we touch, we're cleaning our hands. So that's the first thing, is become a hand Nazi. Everything you know about your hands, just keep them clean and you will not get this disease. The second thing is you have to start psychologically working on the connection between your hands and your face. So I'm terrible at this. I touch my face all the time, literally all the time. You don't even realize it. You move your hand, you scratch your nose. And so the virus has taken advantage of this. And the reason why everyone gets this disease is because you have sustained contact with someone. So someone at a party has this and you shake their hand, right? And then you touch your face. It's that simple. That is how you get this disease. So what does that mean? I think there's two practical things that you can do. One is just to start to be aware of when you touch your face. Atul Gawande, who is a Harvard-trained surgeon, I think is very famous, actually has a recommendation for people to just start wearing masks. And the idea here is not that the mask is going to prevent you from getting COVID, because as I said, it's not a disease that you're most likely getting from the air. But the reason to put on a mask is because, and I do this in the hospital, is you stop touching your face. And so what I would recommend is now when you're leaving your house is to wear a mask. And I think those two things combined is incredibly powerful and will prevent the transmission of the disease into your family in 99% of cases. To know your hands are clean and to not touch your face, period. There are going to be an obscure 0.01% of patients who get it and will just never know. But I think for you, that is an incredibly important way to protect yourself. 3, you don't need a medical mask. You don't need a medical mask. These masks that people are wearing are not protecting them from getting the disease. And front care healthline workers need these masks right now. That's not to say don't wear a medical mask. If you have one, that's great, put it on. But it doesn't mean you have to have a wild supply of masks or N95s or anything like that. The general community has zero need for an N95 mask, zero. In the hospital, where all I do is take care of patients with COVID-19, I only wear a mask, of N95 mask, if I'm in the room with that patient doing something that's going to make them have aerosolization of the virus. That is no one in the community. So to summarize, always know where your hands are. And what I mean by that is when you leave, just become aware of when you're touching stuff that's not from your protected home environment. So if you're going to go to the grocery store, if you're going to touch the cart, just clean the handle. If you go into the store and you see people around, don't touch them. It's incredibly simple. The 4th thing that I'll say, which is the thing that the government is talking about and kind of is the same principle, is distance yourself. And so this is incredibly fascinating in New York City now, is that nobody is going within 3 to 6 feet of each other. And it actually has not changed our life that much. And so I think when you go to the pharmacy, because people are going to the pharmacy now, you don't have to wait directly in line with someone. You can stand a couple feet back. And so the 4 things, I think I said 4 things. Always know where your hands are and have Purell. When you touch stuff that's outside your home, just make sure that you're washing your hand. Start to learn how to not touch your face. A really good way to do that is to start wearing a mask when you're out. And if you want to practice, wear a mask when you're home. Number 3 is you don't need an N95 mask or a medical mask. Any mask will do, because this is not preventing the disease. This is training you. And then the 4th thing is just stay away from people. So that's the nitty gritty of, not stay away from people, stay 3 to 6 feet away from people. So that is the nitty gritty of not how to give yourself this disease or get it from your community where it is at this time.